So if I am missing anyone, please let me know. I am going to go ahead and start the recording.
Kelly, I started it when you started talking to make sure everything was on the record.
I was going to say somebody started it. I saw that.
Thank you, Erin. Appreciate that.
And for those of you who have not met Kelly before, she's my new partner in crime in all the TAC and MAC meetings and will be your primary contact when I go on maternity leave. You're in good hands.
Well, thank you. And thank you for getting us opened up. We appreciate that. And Erin, is this your last? Are you getting ready to go out soon?
Yes, I have 25 days until my induction if he doesn't decide he would like to come sooner than that.
Not that you're counting or anything, right?
I'm counting. But I should be back, if all goes well, I should be back by your all's April meeting.
Okay. Well, good luck. Best wishes to you and your little one. And we appreciate everything you all do to keep us moving and in line. And with that, we'll go ahead and call our meeting to order. Who is present from the nursing TAC besides Lisa Lockhart?
Stone.
Dr. Stone? Anyone else?
I thought I saw Jennifer log in, but maybe.
Well, I thought I heard.
Yeah.
Okay. I'm looking down the list.
Your camera on.
A lot of wonderful folks here from Medicaid, from our services.
So if Jennifer is not on, we do not have a quorum.
So we cannot do approval of the minutes. So we'll table that and maybe we can do it unofficially by email. That's always possible.
No, ma'am, you have to do that in your public meeting.
I'm sorry.
You have to approve your minutes via the meeting. So if you don't have a quorum this meeting.
So we'll have to wait.
Yes, ma'am.
Okay, all right, I understand. I forget some meetings I have, we can do it the other way. Thank you for the reminder. Okay, well, with that, we'll go ahead and move on to old business. On the list of old business is nurse practitioner reimbursement for preventive health services in schools. Dr. Stone, I believe that's your forte, so to speak.
Yes, I was just wondering if we had any updates on why the nurse practitioners aren't being paid with the sufficient 75% of the fee schedule.
Hi, Dr. Stone. So I did do some research into the codes that you sent, and the reimbursement for school-based services is a bit different than the fee schedule. But looking into our system, the rate type that was set for those codes was the one that was first generated when expanded access was new, like when we first put in those codes in 2019. And somehow they were not updated with the new rate type of SBS for school-based services. And so that's something we're going to have to fix. And once we do that, those rates should be adjusted. I can't tell you exactly where they're going to be. That's something I'll have to work with Fairbanks to determine how we're going to set those rates. But those, I do expect those to be increased. I just can't give you an exact amount of where that reimbursement is going to be. But we have identified where that issue is, and that is something that we are working to fix.
Thanks so much, Erica. So those districts that had been paid at the lower rate, will they be would they get back payment, I guess, for those services that they've already provided, or how will that work?
I'm not sure of that. I can take that to leadership and determine if they want, if they will allow us to do that, to have those claims resubmitted.
Thanks, Erica.
You're welcome.
You're always so helpful.
Well, thank you.
Always, yeah, always. So thank you for that. And Erica, and we're going to back up just a moment because I think we have a quorum now. Dee Polito and Jennifer Wiseman have joined, correct?
Yes, hello.
Hi. So we just want to back up just a little bit, guys, so we can move to approve the minutes from 12:08.
Everyone, all members need to have their cameras turned on for voting.
Jennifer, can you turn your camera on? Can you hear us?
Lisa, I'll move to accept the minutes as written.
Okay, great. Thank you. She can hear us. We just can't see her. Oh, there she is. Hi. Do you approve of the minutes?
Yeah, I can second that.
Okay, okay, great. Is that an all approve? I'll say aye.
Aye.
Aye, great. Okay, we have approved minutes. That's wonderful. Thank you all very much. So we'll move on to our new business. And that is a request for MCOs to provide updates for TAC on how ending of the national state of emergency will impact families related to Medicaid enrollment. That's quite a topic. I mean, there's been a lot of discussion lately about that. So we'll open the floor on that one. Who wants to? Who's got anything? Oh, April Hester has joined too. Welcome, welcome, welcome.
Hey there. I've been on. I just voted.
Oh, that's right. Okay, I'm sorry. I'm sorry you did. Okay.
No worries. I just turned my camera off. I'm in a patient care area at work and I just want
Okay,
to follow
I
the
totally
quick-
understand. I'm at the hospital too. I totally understand.
Yeah.
Okay.
If it's okay, I'm happy to share my screen.
Yeah.
This is Victoria with Anthem Medicaid.
Oh, great, great. Thank you.
Okay, let me make you a co-host. Let me stop sharing. And I will make you a co-host. Okay, you should be able to share your screen now.
Thank you. Can you see that?
Yes.
So as you can see, this is a breakdown for Kentucky member renewals as we begin unwinding. We are looking about 151,000 members in Kentucky with renewal dates in facets and 9K averaging starting in April 2023. These are 50% residing in the top 20 counties. So you can see we have a heat map here really showing based off of Medicaid membership, 1 to 10,000 of those that will be those counties of focus that will be impacted the most. And a lot of that will be as we begin unwinding and stuff with renewals, redeterminations, the first part of the quarter, those individuals will be focused more on passive renewals. But then when you get into the April on, that's where we really need to make sure that education piece is there from the Medicaid members individually. And that's what each MCO has been working on to make sure that, you know, we have things in line to support our members during this time in these upcoming months. Would you like me to send this to you?
Yeah, that would be great. I'm just curious. So, so everybody's going to have to re-enroll, is what you're saying. And then, so of those members and the outreach, what kinds of outreach will be done to families? And, you know, is there any differentiation by language and so on?
So we actually, the state is scheduling meetings, and we have a meeting next week to really discuss with the MCOs what that outreach will look like. So I don't want to speak on behalf of that just yet, but I do know starting next week, we will have more information from an NCO perspective to be able to provide you and support our members with communications moving forward.
And if you want to send that to me, it's put my email address in the chat and I'll make sure that gets out to the TAC.
Thank you so much.
You're welcome.
Wonderful, thank you. Any other questions regarding that? No? Okay.
Are any
So
of the other,
yeah, moving along. Request for DMS. I'm sorry.
Lisa, are any of the other MCOs presenting or just Anthem?
That item
Anyone
is,
else?
Ms. Eva,
Hi.
so we have a presentation ready, but they may be able to discuss what they're working on.
Hi, this is Samantha Harrison with Humana Healthy Horizons in Kentucky. We are awaiting the determination by the department as to how they are approaching the redetermination date. I know they will be rolling out a plan that will address various, the timing of those redetermination dates, as well as the family unit aspect. I'm not going to speak on behalf of the other MCOs. I do know that our plan does have a project and a work group developed to do appropriate outreach once we receive that information from the department and to assist in education. So with that being said, once we hear more information of the detailed rollout in regards to how the department plans to update redetermination dates, we'll have more information that we could share in the future.
This is Jennifer from Aetna, and similar to what others have shared, we're awaiting updated information to assess the full scope of impact. We also have an internal work group that has been formed. We've got plans for both telephonic and mail outreach to members, potentially text and email as well, once we have an idea of what that scope looks like. We might tier those communications depending on the final numbers from DMS. So while we're working internally to get all of the communications up and running, we have those contingency plans based on volume and the go forward redetermination rolling date.
Hi, this is Shannon with WellCare, and just kind of piggybacking on what folks are saying. We too have had a lot of internal strategic plans around how we're going to move forward with this, the outreach process, identifying the members and so forth. Again, looking to our partners for the dates and guidance on that. But I can submit something later if you need a slide or presentation, but overall just strategic sessions.
Good afternoon. This is Anna Page from Passport by Melina. We are doing exactly the same as the other MCOs, developing strategies and working within groups to ensure a smooth transition.
Anyone else? Is that everybody? Okay. Okay, to move to the next item.
This is Suzanne Lewis from United. I was having a little bit of an issue.
Wonderful. Okay, go ahead. I'm sorry.
That's okay. I was trying to find the mute button on Zoom. My apologies.
I feel you.
Yeah, like the other health, like Humana and Aetna as well, and WellCare. We are doing the same thing. We're having conversations and again, awaiting a little bit more information. So just kind of in the same position.
Okay, wonderful. Anyone else? We love hearing from everybody. Okay, to proceed to the next agenda item. Okay, moving along. Thank you all very, very much for the input. Request for DMS to present to TAC to explain presumptive Medicaid eligibility for children ages 1 to 17 and describe eligibility requirements as well as options for healthcare for immigrant refugee children coming into Kentucky. That's one question in multiple parts. Who would like to speak first?
Well, this is Justin Derringer with Kentucky Department for Medicaid Services, and I know right now is we're going through some personnel change in eligibilities area. We have a assistant director and a branch manager that both retired at the same time, so we have some employees here from eligibility to talk a little bit about presumptive eligibility and dig into the immigrant refugee children a little bit more. I can tell you that as far as immigrant refugee children, they are eligible for emergency Medicaid, and that emergency Medicaid is automatically given for 12 months, and it covers any emergency service that they may need. So any kind of emergency that they have, and there's a large list of what that is and what it is not. But any kind of emergency that they need that covers them for those emergency services only. But I didn't know, Jordan, are you on? Would you like to talk a little bit about some of the other eligibility question there?
Sure. If I could, let's see, let me share my screen. Oh, am I able to share my screen, or I can just talk from my list of stuff here?
I think
Yeah,
Aaron
well, I can let
can
you share your
help you with
screen.
that.
Let me make you co-host. Hang on just a second.
Thank you.
You're welcome. Okay, you should be able to share now.
Awesome. So I'm kind of cheating a little bit here. We already have this PowerPoint set up. It was part of the hospital presumptive eligibility for Medicaid services provider certification training program. So I don't know if you all have already seen this or not, but it goes through everything to do with PE. So it's got expected results. Obviously it's temporary coverage, and we allow that because we expect that they're going to apply and be eligible for full Medicaid benefits within 60 days. Who's authorized to do the PE determinations. So you have to participate in the Medicaid program, have access to the internet, complete the certification training program, and then also abide by the standards of the Medicaid agency. Services covered include hospital, pharmacy, emergency room services, physician, dental, lab, x-rays. This is for all groups except pregnant women. They have a different list of services. These are some restrictions that are for the pregnant women group only. Sorry, I'm trying to get this thing out of the way and it won't go away. Okay. So who can receive coverage through PE? These are individuals who do not currently receive Medicaid benefits. They cannot have been approved for PE benefits during the current calendar year. They cannot be an inmate in a public institution. They must be a U.S. citizen or have status as a national or some satisfactory immigration status. That definition is what's considered lawfully present. So as long as they have not, as long as they have lawful presence here in the U.S. and they have not, hold on, let me find my definition. So they have to have not violated the terms of their status here in the U.S. to be considered lawfully present, basically. It's a little bit more broader definition than a qualified alien,
Qualified alien status means that they have some kind of like citizenship here in the works, or they're they're a permanent resident, something of that nature. So lawfully present is a little bit more of a broader description there, just for reference.
So Jordan, can I ask a question about that?
Sure.
So that extends to children as well. What's the definition for U.S. citizen for, you know, say a child comes into this country? It's the same. And this is I don't know what kids have to go through as far as getting citizenship.
Yes, so that same definition of lawfully present applies to children as well.
I have a question because a couple of slides back, you talked about what hoops they had to jump through to get this process going. I guess I'm concerned about the immigrants, the immigration piece of it, and this conversation we're having here about qualifications, because I think there's a lot of room for people to fall through the slats in the floor, if you will.
Right. Yeah, I understand that concern for sure. It does have a note here, non-qualified citizenship requires a medical emergency, like Justin was saying earlier. So there is still that coverage available to individuals who are not considered a qualified citizen. And then the Medicaid, which he discussed a little bit of, Medicaid for immigrant children also includes that definition of lawfully present. So they don't have to be a qualified alien, which is a more stricter set of rules. They just have to meet that definition of lawfully present to be eligible, as long as they're under age 19. So
is that
And just a reminder, Medicaid is something that is, most of emergency Medicaid is dictated by CMS. So we would have to submit some type of waiver system in order to reach out to cover any more people, and we'd have to show fiscally how we could afford that. And so there's a lot of process steps behind that that would probably take a few years, as far as, you know, being able to cover other individuals for other things. We do have emergency Medicaid in place now that covers all individuals, regardless of you know, that have any other legal status other than you know, illegal or immigrant status, that is there for emergencies.
So that was what I was going to ask, if that was federal requirements or if it was state requirements. But just to speak to the issue that's happening now, for example, I work in Jefferson County schools, and we've got about 12,000 children who are not current on the measles, mumps, rubella vaccine. And a lot of that is, we've got 16,000 immigrant refugee children in our district right now who are uninsured. And so people would think, well, they could just go to their health department for their vaccines. But in Louisville, the health department has 2 clinics that aren't open every day, and they're Monday through Friday clinics. And so there's no way the capacity can meet the need. And so that puts everybody at risk, because we've been named one of the areas that's high risk for measles outbreak. And that's just one example, but Bowling Green's having the same issue. Northern Kentucky's having some issues. And so just some things like that is really what brought this question to mind, because I didn't realize, because it was so much less restricted during the pandemic. Kids could have preventive care, and my understanding is that all went away in the fall, which is what prompted the questions, but also lots of concern.
Well, and one other thing to consider is, depending on the immigrant group, different immigrant groups will have different eligibility types and requirements. So some immigrant groups that are required will be able to have different statuses. So you'd have to kind of specifically talk to what immigrant group you're talking about, for where they come from when they came over, because certain situations and emergencies in other countries CMS will send out that these immigrants that come over from these countries due to this crisis in this amount of time, in this time frame, are allowed other privileges. So, you'd have to kind of dig into it.
Okay, so is that on CMS's website, or where would we find that?
So I know that the DCBS policy manual has a list of all people that are considered in refugee status or meet some other criteria to be eligible. And I'm pretty sure it's available to everyone on the internet. So I don't mind, linking a copy of that. So you all will have that list.
That'd be great.
And their DCBS worker, their local DCBS worker will have that available as well.
Yes. Okay. Continuing, let's see. They obviously have to be residents of the Commonwealth. And then it has an asterisk down here that PE for pregnant women is limited to 1 PE determination per pregnancy. Okay. So here we get into the family income limits of who can receive coverage at what federal poverty limit. So for children 1 to 5, it's 147% of the federal poverty limit. And for children 6 to 18, it's 138%. There is no income limit for former foster care children age 19 and under 26. So these are the different categories. We have the adult category, pregnant women, children, and former foster care. This is a note here. Their coverage will continue until a Medicaid application is filed and either approved or denied, or on the last day of the second month after determination of PE, if no Medicaid application is filed. Because again, we go back to what our expectations are with this. We expect that they're going to apply and be approved for ongoing Medicaid coverage. And these are the ways that they can apply in the meantime while they have their presumptive eligibility. So this is the process. They appear to need financial assistance. They meet their financial criteria. Whoever's taking the application, or they will collect information either on the worksheet that I'll show later or enter directly into Connect. The office itself can enter the patient data on self-service portal and then immediately print out a PE card to be available. So as an application taker, basically you're going to assist the patient in completing the patient information form if you're using that, assist in determining the number of people in their family, and then assist in calculating the monthly family income so that we can determine financial eligibility. This is the patient information form. Not a very high-res image, but that's it. Most people do it online now. It's a little bit easier than just filling out the paper form, but it's still there. So when determining family size, you count the patient, the unborn child or children, dependent children living with the patient under age 19, spouse, and then parents and siblings under 19, including step parents. You do not count an unborn child's father if they're not married to the patient, or dependent children not living in the home and not claimed on their tax returns. When we look at income, we're talking wages and paychecks, Social Security, pension, alimony, annuities, unemployment benefits. We do not count child support or SSI, and we accept client statement of these incomes. So to get their monthly income, you would just multiply their weekly income by 4 or their biweekly income by 2. You only count the income of the adult patient and spouse and the parents if a child is under 19. So this is a little bit outdated. We have new numbers for 2023. But these are the typical, what would be 2022 numbers for family size and their annual household income. Again, outdated numbers, but this is for 200% of the FPL. Okay. There is no income limit. Sorry. There's no income limit for former foster children. Client statement is acceptable verification for their foster care status. And then this goes into more technical information about how you obtain your PE confirmation or how you become a qualified entity to be able to take PE applications. And how to print the confirmation ID card. They're going to be placed with a managed care organization. Member eligibility information and MCO assignment will be available on Kentucky Health Net the day following the initial day of eligibility determination. This might be outdated too, because I think they're with United Healthcare. They don't have to choose an MCO. So that's pretty much the eligibility questions. Does anybody have any other additional questions regarding PE that we can help with?
That was really good. Thank you.
Yeah, no problem.
Jordan, if you'll send me that presentation, I'm happy to email it out to the members of the TAC.
Yeah, sure, no problem.
Yeah, that was very helpful. Thank you very, very much. Anyone else care to speak? Is that it for responses? We'll move on to the next agenda item if it is. Great information. Thank you very, very much. So the next agenda item is to receive update on school-based TAG work group. That was talked about. Oh, I'm sorry. I almost lost my mind there.
Hi, hello again. So we did have our very first school-based technical assistance guide work group meeting, January. I forget the exact date. It was the last Thursday of January. And for that first meeting, we did have 29 participants. And coming away with that, we had several questions that we are taking back to leadership to get a decision on. One of those being covering nursing service for the entire day for observing and providing assistance to those children that are dependent on ventilators. Another question is on covering the preventive exams for children during the summer when they are not enrolled in school, but for getting them prepared for enrollment. And the other question was on some different nursing services that haven't been covered previously. And these are like health education pieces. And we do have that list of questions prepared, and we just haven't submitted it to leadership yet, but we should have an update on those for our February meeting.
Wonderful. Thank you.
You're welcome.
Any other questions or discussion? Dr. Stone, did you have something?
I was just going to thank Erica.
Yeah. Yeah, very good. Thank you very much. Okay, and then our last agenda item is to receive an update from DMS on maternal child health and disparities for women of color.
This is Justin Derringer again. I believe Dr. Terrio was unable to make it. She had a conflict come up, so I'm sure that she has a report or an update to give you all on that, but she may have to email that out because wasn't able to make it today.
Okay. All right. Well, that leaves the floor open. Any items for discussion? And we certainly will carry that last item over for our next meeting. Anything any of our MCOs wish to discuss or bring forward? Any of our TAC members have anything they want to bring forward? Dr. Stone?
I don't have anything in addition
Okay,
to what we
all right.
discussed. Thanks, Lisa.
DePolito, anything?
Thanks, Lisa. I don't have anything.
Okay, okay. Jennifer Wiseman, anything from you? April Hester, anything from you?
No, ma'am, but I appreciate you asking.
Okay. Wow, this was a quick meeting then. I am grateful for everybody that took the time to join in. We appreciate the input on all of our new business items. Excited to hear the work going on with the school-based TAG work group. Really appreciate the presentations and your willingness to share them with us so that we can take them and share them. I'll bring some of this back to K&A as well. I don't have anything else to add. If nobody else does, we can call this an early afternoon then. Do we have a motion to adjourn?
I'll make that motion to adjourn.
Thank you. Can I have a second?
And I will second.
Okay. I guess that calls it an afternoon then. Again, thank you all for giving of your time today. It matters. Everything we do matters. Thank you.